Continuing our series of the psychotherapy process, today we'll take a look at the fifth step of the psychotherapy process, which is the treatment plan or therapy. The psychotherapy process is a 7-step process. We saw the steps. The first step is to take case history. Second step is psychological testing if necessary. Third step is diagnosis. Fourth is pathogenesis. Fifth is treatment plan or therapy, developing the treatment plan or doing therapy. Sixth is supervision, and seventh is termination. Today we will take a look at step 5 of the 7-step process, the psychotherapy process. And this is the most important part from a practical point of view for therapists, because this is the step at which we actually do therapy. So let us look at what is the treatment plan and how therapy is so important in the treatment plan. Treatment plan essentially has to be a holistic healing plan, which has to include all that is necessary for healing of the patient as quickly, as deeply, and as permanently as possible. Unfortunately, the healing landscape has got divided into silos, and each silo is on its own trip of omnipotence. If we are honest enough, we realize on the healing path, regardless of which modality of healing we are practicing, this generic truth that everything works on someone and nothing works on everyone. Every healing method has its own strengths and limitations. Therefore, we need a basket full of tools so that we can pick and choose based upon the patient what the healing plan has to be like. This is the work of next 25 years. Next 25 years, we will be developing a clear grid of holistic healing, which tells us that for a given personality, given pathology, and given intensity, given these three things, how should a holistic healing plan be worked out? This calls for some empirical work to understand individual healing methods and then to understand their coming together. This is the work of next 25 years to create this table that given the personality, given the pathology, given the intensity, what should be the holistic healing plan look like? Should it be only medication? Should it be only therapy? Should it be only pranic healing or Reiki? Should you combine all of them? And if you combine all of them, how do you sequence each of them, or do you put them two together going on at once? And if you have to chronologically put them, how do you decide the chronological plan? When do you introduce one particular modality and for what purpose? Can you introduce a modality only for a limited purpose and then withdraw it? All these questions are questions of next 25 years of empirical work in holistic healing. Irony is, even while the professional community is not ready to graduate into this landscape of holistic healing, and everyone is holding on to his own limited area as omnipotent, patients have already moved into the holistic healing area. At times unknown to the healer, who may be practicing psychiatry or therapy, the patient already is taking Reiki or pranic healing without discussing it with the healer, because most patients fear that the healers who are trained officially in an empirical method, they will look down upon, they will mock at, or they will criticize, or they will try to stop the patients accessing holistic healing tools like Reiki, pranic healing, homeopathy, yoga, tai chi. So the patients are already into holistic healing era, although we are yet to catch up. And we will catch up only when we have a scientific base to justify our movement into that area. So the core is to do empirical work so that we understand each of the methods and then how to combine them together. The earlier we do, the better it is. So when we talk of treatment plan, ideally it involves these components. Medication, if we talk of mild, moderate and severe categories, mild and mild to moderate, medication may not be a compulsion, but moderate to severe and severe, of course, you require medication. Medication can be allopathic, it can be homeopathic. In some countries, traditional medication also is allowed. So medication is one, and this is a form of passive healing. So all healing modalities you can divide into two: active healing and passive healing. Active healing, where the person has to participate in the healing process and work for his own healing. Whereas passive healing methods are those methods where somebody else is doing healing to you and you are passive, or you just take a medicine and the medicine works in you, you are again passive. Passive healing always is easier than active healing. Few people are ready for active healing. However, the personal growth and the deep long-term work that happens in active healing cannot happen in passive healing in most cases. In a few cases it does. In a few cases of passive healing, especially with homeopathy and certain forms of pranic healing, at times you do get long-term results. However, in 99% of passive healing cases, let me not say 99, let me say 75% cases of passive healing, personal growth and deep long-term work which has its own benefits, that does not happen, and that happens in active healing. But active healing is difficult, painful, time-consuming and very costly. Whereas passive healing is a very affordable, easy, and you can easily scale up on a public health scale. But active healing, to scale up on a mass social scale, requires so many experts, it's very difficult to scale up in that way. So for a considerable period of time, we will see passive healing comprising 75% of the healing landscape and active healing not more than 20 to 30% of the healing landscape. More people become aware about health, more they are able to put in efforts, and more they care about personal growth and self-reflection and a Socratic self-knowing, more they will go into active healing. Active healing, if you want to scale up, the only way you can do it is by group therapy. So group therapy is the next area we really have to focus upon if we have to scale up the psychological health area or the well-being area on a large social scale. There is no way out but group therapy. And this can be done with traditional group therapy method or using technology, especially artificial intelligence and virtual reality. These will be very important tools. Some people are also trying with psychedelics. Combined with this, we'll see how it emerges as a model, but this is the likely outcome that we will see in the next 5 to 10 years. I had tested out a model on a small scale where we could use WhatsApp to provide group therapy to clients who cannot afford it otherwise and who live in those areas of India where there is no medical health professional, no mental health professional in that particular village or in that particular vicinity. And there we can do it even while we maintain confidentiality of the person. So this WhatsApp based, highly scalable and very affordable technology enabled confidentiality maintaining group therapy is a model that we should work on more to perfect, and I hope it will be scalable. It is scalable, it's just a question of trying it out on a larger scale. So coming back to active healing and passive healing, medication is a passive healing approach, therapy is an active healing approach. Yoga is an active healing approach. Pranic healing can be both. If somebody does pranic healing to you, he gives you pranic healing, it becomes a passive approach. If you do pranic healing for yourself, it becomes an active approach. Homeopathy also is a passive approach. You take medication, the medication works in you. So allopathy, Ayurveda, homeopathy, Siddha, they are all passive approaches. Therapy, yoga, doing pranic healing to yourself, Reiki to yourself, Tai Chi to yourself. These are all active healing methods. So the treatment plan has to include one, medication if necessary. In some countries, this decision is taken only by psychiatrists. In some countries, even the decision for therapy is taken only by a few qualified professionals, and every MA clinical psychology cannot take that decision. But in most other countries, once you are chartered or once you are licensed, those rights, they come to you in terms of prescribing something. So the first element of treatment plan is medication, done by psychiatrists or by homeopath, as the case may be. Second element of treatment plan is therapy, done by psychotherapist. Third is self-work. Some therapies use self-work, give some self-work to the patient that he can do between 2 sessions. Some therapies don't use self-work. CBT uses self-work. Psychoanalytic psychotherapy does not use self-work. Behavioral approaches use a lot of self-work. So there are exercises created for self-work, which I believe we are underutilizing in psychoanalytic psychotherapy. We should be using more of self-work in psychoanalytic psychotherapy now that people are finding it very difficult to come 5 days a week or 3 days a week, and most people have reduced to 2 days a week. We have considerable time in which to give some self-work to be done. Psychoanalytic psychotherapy, because always it was 3 days a week or 5 days a week, there was no need per se for self-work. But if you are looking at once a week or twice a week, which is more of becoming a norm now, given the pace of life and the difficulty of traffic, especially in India, self-work as a tool may have to be used in the Indian conditions between 2 sessions, even in psychoanalytic psychotherapy. Holistic healing tools like Reiki, pranic healing, Tai Chi, very important elements for healing. Especially pranic healing, I would very strongly recommend for people to learn and try on themselves. WHO also, I believe, has accepted pranic healing as a complementing therapy, not as substitute therapy. Involvement in social activities, especially non-profit activities, and involvement in spiritual groups also brings in relief and improvement to many patients. Of course, it relies on it depends on the personal beliefs of the patient. But if the person is open and happy to do it, then social involvement in non-profit activities and spiritual involvement in spiritual groups provide positive healing support to the patient. A combination of the above can be done. For example, medication and therapy, very common combination. Therapy and holistic healing, another common combination. Medication and holistic healing, another common combination. Medication, therapy, and holistic healing, another common combination. Any combination can be done. In certain cases, all of the above may have to be used. So this treatment plan has to be evolved using all these elements based upon whatever is needed, and then you have to chronologically sequence it in a way that the sequencing is synergetic. So this, in short, is the treatment plan. Details of each element, that's a world into itself. Medication is a world into itself. Therapy is a world into itself. Self-work is a world into itself. Holistic healing is a world into itself. How spiritual movement or involvement in the spiritual movement helps a person, that itself is a study into itself. Involvement in social work, non-profit activities, why does it add to the health of the person? That itself is a subject by itself. Much of it has to do with finding good objects to relate to and deriving the strength of superego satisfaction. So each of what is on the slide is a world into itself. For the moment, we'll just make a note of the fact that these are the elements we have in the basket, and based upon the personality, pathology, intensity, we have to work out, and the more we know different areas, the better we can work out a holistic healing plan. If we don't know pranic healing or Reiki, or how homeopathy can be useful, there is no way we can create a holistic healing plan. So we may be good therapists in our area, but if we have a perspective and some knowledge of other areas, we can create a holistic healing plan, offer it to the person, allow him to exercise his choice, and if he exercises his choice to try out certain things, see how it works. If it works well, support the patient. If it does not work well, do periodic testing and find out how it's going. If it's not going well, we can always withdraw an element. So evolving the treatment plan is step 5 of the 7-step psychotherapy process, and usually in practice, for most therapists, they don't go into anything else. If they feel a situation is moderate to severe or severe, they ask the person first to go to a psychiatrist, and only after the psychiatrist feels that the person is good enough for therapy, they start therapy. If they find somebody mild or mild to moderate, they start therapy by themselves, and this is all they do with the treatment plan. Most therapists don't go into holistic healing or social or spiritual movement or any other sort of thing. Those who do CBT do utilize self-work, but others, they don't go into this area. So for most therapists, conventionally it is doing only therapy. If it is severe, request the person to go to a psychiatrist and take medication, and once in control, come back to therapy. This is all that most do, but those who have an idea about various modalities of healing, and especially those who have tried it out themselves, they go for evolving a holistic treatment plan in which therapy becomes a component, the main component, and others are complementing entities where needed. So this is the treatment plan part of it. Most people think step 5 treatment plan actually is a synonym of therapy, because therapy is all that they do. But actually treatment plan is a wider term than therapy, although therapy for therapists is the main component of the treatment plan. So evolving a treatment plan is a very important element, and this is where therapy comes in. And once you do therapy, then if you need more inputs, you go for the next step of supervision. If you have any questions, write to me at hvindia@gmail.com. Thank you.